as you know, the law school, Seton Hall Law School is in Newark, and we do a lot of work with folks in Newark. And I often see you in Newark. You're very committed to Newark, at Newark Beth Israel, Clara Moss, and just the wellness of people in Newark. When you think about New Jersey's largest city and the quality of healthcare and the inequities that still exist in healthcare in Newark, what do you think we should be focusing on? Not necessarily your RWJBarnabas folks, but we at the law school and we in the community. What should we be focusing on to improve health equity in a city like Newark?
So that is actually the second portion of the first question that you asked for me, right? So that is, and you're right, I love Newark. I think that there's something electric about it. Newark is beyond its renaissance. It really is a model for the rest of the country. And truth be told, we're lucky that we are right here and able to watch it in the midst of its blooming. Newark has an incredible leader. I'm completely biased. I will disclose that up front. He's been a friend of mine for over 20 some odd years. I don't want to date myself. But quite frankly, you know, here you have an individual who is sitting in the seat as mayor, right? So he is CEO of the city, who quite frankly has also been an educator who, since I have known him when he was a teacher, always had a public health lens to everything that he approached, right? And so now he's been a principal, a councilman, and a mayor. He's sitting in that particular seat. Add to that the precious element of this recipe that literally includes the fact that he is the son of a man who had been the voice of the Newark Rebellion, right? Other people in other parts of the country who do not know the rich history of that beautiful city may very well refer to them as riots, but we know that they were not for nothing at all. It was literally a reaction to continued injustice. And as a result of that, you have an individual who looks at it almost through everything, almost as a poetically laced public health lens. It's the reason why we were brought together initially, and here we go with what we can do, right? Everyone, right? So you, Professor John, are literally sitting in an incredible seat of power in this, because you are literally teaching the policymakers of our tomorrow, who we so are in desperate need of, and you get to tell them about the depth of this history. You get to take them outside on a guided classroom tour in order to make certain they understand that it wasn't just that, right? These folks decided to live in poverty at or below a poverty line, slightly above. It wasn't that all the folks came together who said, oh, I know, we want to be, part of the proliferation of an underclass. That's not what happened, right? That there have been systemic and structural issues that have led to what we see today, right? You get to talk to them about suburbanization and what was called white flight. You get to tell them about what happened and why it is that for the longest time, we did not have easy, affordable access to healthy food and produce, right? That now there's Whole Foods, but if you take a look at their hours, I do love them, I'm so sorry, that really they're set up for, right? That it's in the downtown area where the corporations live, but not where the people do. That the hours when they first opened, right, were really convenient for folks who went there to work on their way home and on their way after, and not for the folks who had to work their second and third job elsewhere and then take public transportation to get there. But by God, you get to tell them about the way in which, as large corporations, as large entities, as Seton Hall Law or PSE&G or Prudential, how we can serve as anchors in the city of Newark. We can take a look at who works in our establishment and realize that we all drive in from suburban areas outside of that area, and that, I don't know, might actually have something to do with the fact that the unemployment rate in the city was at one point, right, much higher than the unemployment rate in the state. Mm-hmm. And yet it is home to large-scale corporations like hospitals. Me first, I will always say, don't call my baby ugly, I'll do it myself, right? Hospitals first, right? But we have small little entities that no one else has ever heard of, like United Airlines and Panasonic and PSE&G and Prudential, small, tiny companies like Audible.com, right? So this mayor brought us together around the table and said, you are the anchors of this city. And so while I welcome you to be in the city, I'm going to need you to be of the city too. I'm going to need for you to take a second look at the way in which you hire, your policies, your practices, right? And I say this all the time because it's a painful thing as an institution to have to look at its own internal contribution to the proliferation of healthcare disparities, because that's what it is, my friend, right? When you employ this many people, we've got nearly 44,000 affiliated employees. And you realize that you've existed in the South Ward of Newark for, take Newark Beth Israel Medical Center, over 119 years. What you realize is that the fact that Black infant mortality in that city has remained worse than 3 third world countries, you begin to have to realize that my fingerprints are on some of that, right? And so what have we done in order to invest in the economic stimulus of the local communities? And so a law school can easily do this. A law firm can easily do this, right? Where do you order from? Who are your caterers? Have you taken a look at whether or not you are utilizing local vendors and what you do? Have you shored up to ensure that you're creating opportunity, right? Revisiting those practices to remove whatever those barriers are. We're a large scale organization. We enter group purchasing organizations in order to achieve economies of scale. As a result of that, what we do is we've been with folks who really have businesses in Michigan and Colorado, and they're lovely states, they are, but they do nothing for the health and well-being of my local economy, of my local community. And so traditionally, I invite individuals to go back to the last time they went to a large-scale academic medical center and how they likely drove through an urban environment, right? That as they left their homes and got in their cars, they left greenery and trees and entered concrete buildings and maybe a little graffiti and perhaps an abandoned building over there, that as they drove down that street, they saw a liquor store and then a small storefront church and then another liquor store and then another store. Oh, and then there might have been a fast food restaurant. And then quite frankly over here, one that's not even a chain, you've never even heard of it, but it's there. And then you entered the hospital's ramp, went into the garage, walked over likely a sky bridge, so that your feet don't touch that ground, and into this incredible academic medical center system with high chandeliers, mahogany wood, and wall to ceiling windows. If you walk next to that window and look out of it, it causes you to wonder, how is it that you can say that you take care of people and want them to be well when you've done nothing to eradicate the illness directly outside? So if we were more intentional about our practices, right? When we did it, self-disclosure, I took a look at our policies around HR and literally said, so let's revisit these job descriptions, because I don't know about you, but I tend to think that we really don't need a master's in library science to be a thought. We have created policies that create barriers that continue what we see outside.
I'm worried, particularly in light of the inequity that people in some parts of New Jersey experience in their contacts with the healthcare delivery system, that they will be distrustful of contact tracing. And I wonder if you've struggled with the notion of how the approach to those to people in those populations who feel disenfranchised might be dealt with so that they are comfortable enough to cooperate and help us to defeat the COVID problem.
Yeah. So I think that that's an incredibly important element to all of this. It's an ingredient that we acknowledge on that public health task force very early on. And I, right, and pretty candid and said, listen, everything that we're doing is going to have to both go through a cultural competence, right, level, as well as a racial equity assessment tool, so that we ensure that we are asking the right questions and not continuing the proliferation of disenfranchisement in any way. I think that actually, and know for a fact that the way in which the state is entered a contract with the Rutgers School of Public Health for contact tracers, I know that the state wants thousands, but they're going to begin with a few hundred. That the one additional element that I talked about, because everyone was just like, this is great, so the students can do that. And I was like, excuse me, I'm sorry, hi. So what you can't do is bring in students who come from a different lived experience and a different background without the proper amount of training, sensitivity, and here's the rub on that, right? Because folks are like, yeah, no, we're going to train them. I was like, yeah. So what I'm telling you is because of the way in which unfortunately, racist ideology, I want to call it something else. I'm not certain what that is. You can come up with that word. Is literally a part of the very fabric of as we grow up in this country, right? That without clear and delineated efforts to reduce that continuously, you got to take the implicit bias test more than just once and think you're good to go, right?
Yeah.
So I'm deeply concerned about that. I'm also concerned about and I've expressed this to be fair, right? That we ensure that we are saying so you're actually going to create anger within a community if in fact at any time when we talk about these particular communities already vulnerable to COVID as a result of what we've talked about and the history that comes with it. If you're going to send in bands of folks who don't come from there, don't look like them, don't have the experience of how to deal most respectfully with lots. I remember this in a particular presidential campaign, also around the same time that when we were in office together down in state government, and hearing about, a group of mainstream students, from the Midwest coming and going into Black churches and calling, mothers of the church, which is what they are called by their first names. Egads, like, I'm just like, oh no, pull them all out right away, right? You cannot look at somebody and call her Sarah. That is Miss Sarah to you, right? There is no way you can do this in lack of cultural competency technique in this. What I'm deeply concerned about is that we may not even have the time to do the depth that we would want. So it's really keenly important, if you get back to what I said earlier about taking on an anchor mission, this effort should too. And so I'm like, well, why aren't we locally sourcing? We have seen the community health model, and we know that there is a certain level of trust when these are individuals not from up the highway, but up the street. We know that when the person who knocks on their door is the person that they just went to church with on Sunday or sat on the stoop with last Tuesday, that there is a greater likelihood, not just that they're going to open the door and talk to them to of response, but of truthful response.
Mm-hmm. Yeah.
And I think that is a key element here.
Well, I'm glad that Mayor Baraka has asked you to help him. I know that he's right with you on these issues, but having you to help him is a great thing. So, Michellene, I want to just ask you one more question before we let you go back to your work. You speak often, and when you speak, you focus on three things: purpose, power, and passion. How do those themes translate for you into how law students should think about forming themselves as professionals?
I think that so much of that really comes from a core place. What I would love is to encourage them to find what they are most passionate about, right? And not to leave that in the car when they get out of it to enter the law firm or corporation counsel's office or the corporate entity for which they work or the institution for which they will one day become the GC. I think it's really important that they bring that with them too, right? There are some who are incredibly passionate about the environment. There are others who are incredibly passionate, like I am, about injustice anywhere. There are some who, are really passionate about families and really theirs, and even others. There are some who are really dedicated to children, but that they need to truly explore that about themselves for two reasons. One, so that they have a intentionality about truly knowing who they are, right? What resonates most with you in the belly of your being, right? And how can you lend in some way, some element of your talent in order to furthering that, right? What do you spend your time doing? How much you want to spend it differently. But why do I say this? I say this because what I think that COVID-19 has also shown us, quite frankly, is that the time that we all thought that we had to get to that point where we get to do that thing that we love is not promised.
Yeah. Yeah.
And so it's imperative that they are being deliberate right now. Don't wait. Right now. You deserve it. You deserve it, right? You are a worthy, whole, valuable human being, not just your mind and your legal interpretation, right? But your lived experience, right? Yeah, anything from going through your parents' divorce and or having to lose a loved one, right? When you had to bury your cat and it really, did something to you. So you love animals. I love animals, full disclosure. So as a result, what aspect of that lived experience can you also add to whatever it is that you are taxed with doing? I don't care if it's tax law or, anything else. It's really a key component to being your best self in that environment. And when you do that, you inevitably permit others to do the same.
Well, thank you. I can't speak with you without feeling inspired myself. So I appreciate your time. You're such an inspiration for all of us. And thank you for your work, and thank you for the credit you do the institutions that you graduated from. So thank you, Michellene.
Thank you, my friend.